As long as there have been playwrights and poets, there's been an interest in physical intimacy. The essential point in this conversation is that physical intimacy is an integral part of the rehabilitation process after a cardiac event. And for most people, it is possible. Well, it is a very important part of the healing process, and I think in our digitized medicine, we can get ourselves so caught up in prescribing pills that we don't get into the discussion as much as we should. So I think that that is what it is that has to be emphasized, that the power of love is engaged. One of the things we need to do with patients that come out of the hospital, and the problem we have is patients are afraid to ask, when can I return to the idea of physical intimacy? What can we do and what can't we do? And it's very clear that yes, sex is okay after heart attacks. Yes, sex is okay after angioplasty. Yes, sex is okay after surgery. The amount of energy that it requires is less than what it takes to walk up 2 flights of stairs. So if you can walk up 2 flights of stairs, you're in good shape. Is there a way to lower my risk of a cardiac event with sex? Understand, heart attacks with sexual intimacy are rare. They happen in athletic situations rather than intimate personal situations. And don't be afraid of it, and if you are, have that conversation with your medical caregiver. This is one of the great advantages of cardiac rehabilitation programs, is twofold. One is you actually get to test out these different forms of exercise and use different parts of your body, and you get confidence from that. You also get confidence from sharing stories with the other patients that are there. So whether it's an automobile accident, a cardiac event, for men and for women, there's a post-traumatic experience that needs to be shared. It's a team sport. It needs to be shared with medical professionals. It needs to be shared with your best friends. It needs to be shared with your family. Physical intimacy is a key part of that. There are very few situations where that needs to be restricted. So if you have any questions about it, be forthcoming in your questions and expect your caregiver to be similarly forthcoming in the answers.